As we commemorate Women's Month, incidents of gender-based violence recorded just this month continue to rise. According to the Minister of Police, Bheki, Cele, gender-based violence is the biggest contributor in violent crimes recorded in the first quarter of 2021. Civil organization centers have called for more support from law enforcement agencies and community engagements to deal with the scourge of gender-based violence. We take this discussion further then, and we bring in the Executive Director of Masimanyane Women's Rights International, Dr. Lesley Foster, and Vanita from Rise Up Against Gender-Based Violence. A very good afternoon to you, ladies. Thank you so very much for joining us here on SABC News. Let me start with you, Vanita. You're from Rise Up Against Gender-Based Violence. I mean, you must have seen, as the police minister was talking about the police, the crime stats this week, that we have a rise in really every category of crime that there is, apart from two. But mostly, if you would have seen, specifically when we're talking about gender-based violence. I mean, what do you say to this? It does seem as though we really are losing the fight against gender-based violence. And ironically as well, we get these stats during Women's Month, which paints such a scary picture for us. So, Vanita, what do you have to say to this?
Well, obviously, we are... I mean, it's horrible to say this, but we are not even shocked at the crime stats at all. We work in the sector every single day, and we see these horrific cases every single day. And so for us, it's not a surprise at all to see an increase in crime. I mean, for the last few years, sexual violence crimes have increased steadily. And so it does create, or it does send a message that we are busy losing the fight against GBV. And it's sad to say that, because even though there's a lot more talk around the topic and we get a lot more coverage, unfortunately only in Women's Month and times such as 16 days of activism. But these are not new cases for us at all. And, you know, I was on a previous program where I said maybe what we should be doing to kind of shock people into the realization that this is an everyday occurrence is to have a daily stat around GBV and reporting on it the way that we're reporting on COVID every single day, so that people can actually realize that this is not an anomaly. This is our daily lived experience every single day in this country as women.
Yeah. Dr. Lesley, Dr. Foster, pardon me, please let me bring you in here. In your capacity, you know, as an advocate for women's rights internationally, what is lacking, you know, for women to be protected and to be safe within their societies? I mean, it must be quite concerning for you to hear Vanita saying that, well, you know what, these stats aren't even surprising. And quite frankly, even as we report here, you know, as news anchors, as journalists, the stats aren't surprising anymore. Every day that I sit here, there's something that's happened to either children or to women. It is such a big reality to all of us. And really, it's sadly not surprising at all.
Well, the first thing I'd like to say, good afternoon to everybody, is that Masimanyane Women's Rights International is outraged at the death of yet another young woman. Yeah. Because, as Vanita said, it means that we are not winning this particular fight. However, you know, we have got strategies in place now. And what we've discovered, because we've had 20 odd years of looking into this issue and watching it rise, is that we have in the past focused on victim empowerment. What we realized was that we had to have a whole of society approach, and that we needed to look at all areas of women's lives and of our lives as society, because it's a societal problem. So women's lives are not valued as yet, and we have to shift that thinking into understanding that women's lives are as important as the lives of anybody else in this country. What is important now is that the country has got a national strategic plan on gender-based violence, which has 6 pillars. And our belief is that if we work on these 6 pillars, we are going to start to see the shift in attitude and behaviors. We're going to see the structural shifts, because violence against women is a political issue. It's a political issue, and it needs a structural shift. So we have to look at all 6 of those pillars. You know, the issue of accountability and leadership. We don't want leadership who rise up when one woman is killed or when 3 rapes happen. We want outrage at every single rape, sexual abuse, domestic violence, and femicide case. Then we will start to see the shift. This plan is being put in place at the moment, both by the state and civil society, and I believe that everybody's pushing their energy into it. It is an outrage to all of us that Cele has lost her life and that other young women in this week have lost their lives. I've just seen the list of women that have been killed in the Eastern Cape. Women should not be killed simply because they are women. This has to stop. And we keep on thinking about, we'll try this or do or that. It doesn't work. We have to have a whole of society, a comprehensive, holistic approach. And the most important thing that we have been slack on is prevention. We can't work with a victim when the violence has already occurred. The most important thing is to stop the violence from occurring, working on attitudes and behavior, working on community education, and working on the education of state agents such as the police, such as health professionals who are also, able to contribute very much to the sector.
Yeah. Vanita, let me bring you back in now in terms of what to do. I mean, Dr. Foster has kind of touched on that. I mean, is there where we are perhaps at all making some sort of strides? I'm going to park the issue of the crime stats. I mean, just yesterday we heard the Police Commissioner Cele saying that we aren't in fact losing the battle, and I argued yesterday that it seems that we are in fact losing the battle, but maybe there are some strides that, I'm ignoring that we have made. You'll remember when Uyinene was murdered in the post at the post office. There was a lot of outcry, there was a lot of talk, there were a lot of campaigns, and we were told this wouldn't happen again. And here we are, as Dr. Foster mentions rightly, another young girl, varsity college girl being killed so brutally like this. We're back here again. So it just seems to me that what stride was made actually.
Well, I'm glad that Dr. Foster mentioned, this is a societal issue and it calls on all of us to get involved. And it was really sad that in this instance, there were people that heard the victim scream and did not help, did not come to her aid. And it's an indictment on us as a society. And so, for instance, our organization focuses on prevention. We focus on challenging societal norms and attitudes around women, around GBV. And we've embarked on a program called Tavern Dialogues, where we actually go into taverns and we talk to men around gender-based violence. And we've seen quite a bit of strides from our side in terms of the engagements that we've been having with men around gender-based violence, and not the typical conversation around let's not kill, let's not rape, let's not murder, but really around digging deep into why are we such a violent society. And I think that should be our strategy. Of course, a lot of things needs to be done in terms of the criminal justice system. A lot of things need to be done just in terms of government agencies, coming to the party and playing their part. Listening to the SAPS commissioner now the other day, it was, we could laugh when he said that we're winning this battle, and we are, but we are not. And so a lot of structural issues need to be dealt with, but we do need to get to where we have actual conversations with men around the violence in our society.
Yeah,
and so for us, particular as an organization, that is where we are focused at the moment.
I'm glad you spoke about conversations with men, and this has always been my standpoint, Vanita, that we continually talk to women. We'll say things like "don't walk in the dark." Maybe some people even say dress a specific way when you're at this particular place, instead of actually speaking to the people who are responsible, the perpetrators. That's it, the perpetrators who are responsible for this. And I wonder how then do we start to have different conversations and our wording as well around the campaigns. Where do we, and maybe I'll start with you, Vanita, if you can answer that question, and Dr. Foster, if you can also pick up from where she left off, and perhaps this is where we need to be. And also, I think I'm guilty too. Look at this, I've got a panel with 2 women. Why is there no man in this panel speaking to this issue too? It seems as though we are preaching to the choir.
Yes, definitely. I mean, we were we started the Tavern Dialogues last year. We did 10 dialogues in Gauteng, in Orange Farm. We did 10 dialogues in the Western Cape. We targeted hotspots as was identified by the police minister at that time. And one of the amazing things that came out of the dialogue was how men were really open to the dialogues, and I think it was because of the concept and the way in which we conducted the dialogues themselves. And one of the really frightening things that came out of those dialogues were how men were completely unaware of their friend, the person sitting next to them, being an actual rapist and saying the most unimaginably rapey things in public without fear of reprisal.
Yeah.
And that to me is the challenge for us as a society. How do we instill this belief that there's going to be consequences for you if you are a perpetrator of GBV? And it circles back to the point that Dr. Foster made earlier in terms of women and children's lives are not valued in our society at all. And that is where we need to start. I mean, we work with some organizations, and people come out and they'll have slogans like, let's protect our woman. And immediately that to me is we've lost the battle, because when you say our woman, you mean possession.
Yeah.
You own me. You cannot say our woman. What's wrong with just woman? Because you don't value woman just as a standalone person.
Yeah. Dr. Foster, can you pick up there? Let's continue with that. I mean, Vanita talks about these societal norms, where you speak to people who don't even realize that their own friends are perpetrators, or they themselves have been perpetrators. And then, I mean, just on that too, we've all been guilty where, you'll hear couples arguing or fighting, and we kind of go, well, it's not my business. Almost that sense of normalizing any kind of violence, and one wonders where do we begin, and men indeed calling themselves out.
Yeah. Well, look, as I said earlier on, we need an all-of-society approach to this.
Yeah.
I am a proponent of fighting for women's agency and the recognition of equality in our society. I firmly believe that we will see a reduction in violence once we have a gender equal society. Mm-hmm. Now that task, the task of building a human rights culture of respect for dignity, everyone's dignity and so forth, that's a state responsibility. And we need statewide programs to address those issues. As NGOs, we play a role as well in developing women's agency. Now, we've come a long way in this country. We have a strong legislative framework. We had 3 bills amended related to domestic violence and sexual offences. Those are very important achievements for the women's movement. But what we need now is implementation. And that's where we fall short. We fall short because we have people who talk about our women. We have people who talk about women as victims and not as survivors.
Yeah.
Because women are not all victims. The victim who label takes away the agency that women have, and that they are working towards and fighting. And if you had to be in the march yesterday to see the young women articulate their issues, you would have been so inspired, because they are very clear about what they want. What we need from the state right now, and particularly in East London, in the student precinct, is greater safety precautions. We need proper lighting. We need patrols. We need education of the people in the community, because there's a big drug community there. It is known in the city. All of these things are known, but the violence continues unabated. So impunity is one of the preventative measures. If we bring people to justice, if there's access for justice for survivors of all kinds of violence, then the impunity will begin to recede. And we have a huge problem around that at the moment. Yeah. And with femicide, we, even yesterday, the shame, the blame, the guilt for the violence is put onto the shoulders of women and girls. That is completely wrong. That is where we start to shift the responsibility. Now, men have to do the work. There's work around toxic masculinities, which is historical, comes back from our colonial past. That was a very violent political system. Apartheid was a violent political system, and we've inherited that violence in our society. We have movements like the moral regeneration movement. We have the generation equality movement now that the president is part of, where all of those movements are working together to end the scourge. We have to work in schools, but the structural issues of poverty, of inequality, of lack of access to basic services, lack of access to education, the failure of municipalities, all of those contribute to making women vulnerable. Not men, women vulnerable because of those failures. So when we talk about a whole of society approach, the state has a very strong response that is required. It is required to implement. Then civil society organizations, research institutions. There's a pillar on research and data collection. What we fail to do in our country is to datarize women's experiences. We don't have enough data to show, and we can't quantify some of those experiences. We can't quantify what the impact of rape is on women over their lifespan. And when you're looking at thousands of women, it is worse. The reason why we have so many rape, a 72.4% increase in rape, is largely due to COVID. And the fact that people, women, girl, children, and so forth, have been in isolation, with people, that we've seen an increase in the numbers of children that are being raped. Yeah. So their vulnerability has been increased through the lockdown. The loss of jobs, food insecurity, all of those factors, lack of access to support services, to healthcare, all of those things. So we can't look at one area of women's lives. We have to look at all of them. We have to take a holistic approach and say, we can't fix one thing. We have to fix several things at the same time. And we can do it as a society. We have a big enough country. We have a strong enough women's movement, even if it's not connected, but it is there and it's operating. We have the greatest political commitment we've ever had on violence against women. We need to push that and to gain momentum on it. But immediately, safety for young women in institutions of higher learning, in schools, because the rape in schools, we've been working in Lusikisiki, the stories of rape amongst young children is extremely distressing. So we have to continue being outraged. We cannot normalize violence. We cannot. That would be an indictment against us as a society. And what's happening now is we go, oh, this is so terrible. Yeah. And then tomorrow it's back to work as normal. We have to stop that. We have to be outraged every day. We should be on the streets every day protesting against this kind of violence until women's lives are safe.
Well, it's been a pleasure to have you both here with us here on SABC News, and thank you very much for taking part in this very important conversation. We'll certainly keep touch and keep talking about these issues and bringing you into. Thank you so much for your time, ladies. That's Dr. Lesley Ann Foster
Thank you so much.
From Masimanyane Women's Rights International, and Vanita Daniels from Rise Up Against Gender-Based Violence.